CaseCTRL is I'm Pamela Singh, CEO and co-founder, and CaseCTRL is a patent-pending surgery management platform that uses AI to automate surgery scheduling and cultivate rewarding relationships with every surgical patient. Meet our co-founder's patient, Janet. Janet fell, shattered her knee, and during her 10-minute doctor's visit, her biggest fear comes true. She needs surgery. At home, Janet's overwhelmed with the book of generic instructions she's received, and she calls the doctor's office for help, but plays phone tag with busy staff. Now, on surgery day, Janet anxiously arrives early, dons her hospital gown, and meets her anesthesiologist. But wait, a detail was overlooked in the prep of Janet's surgery. She missed the required clearance from her cardiologist. Janet's surgery is canceled, and she's in tears. As an orthopedic surgeon and engineer, our co-founder, Dr. S2021, couldn't see another one of his patients in tears. So he created an app to streamline his patients' surgical journeys. The 20% decrease in case cancellations had more benefits. But soon his hospital administrators actually came to him asking, how come your practice is so much more efficient than the others? And that's when the app's need truly came to light. 51 million patients are inadequately prepared for surgery, increasing complications, recovery time, and cancellations, and costing $50 billion of surgical revenue in a year alone. In fact, Mayo Clinic has recognized this problem as well. And this is because surgical planning entangles surgeons, scheduler, and stakeholders in an inefficient paper-based coordination process using scans, email, and even fax outside the electronic medical record, or EMR. And one missed detail can lead to a canceled surgery costing $7,100 or another week of pain for patients. Introducing the CaseCTRL solution, the cloud-based surgical management platform that liberates teams and surgeons to focus on patients. It can be used as a standalone system or integrated within the EMR. Now, our vision is to coordinate the end-to-end surgical journey in a matter of clicks. We're starting with the pre-operative process. Currently, surgeons write 8 pages per surgery of complex surgery preferences, such as special implants and tools, in their wonderful handwriting. With CaseCTRL, surgeons craft a complex surgical plan in seconds, reducing transcription errors. Over 40 automated messages coordinate stakeholders, such as vendors, anesthesia providers, and insurance. So what used to take schedulers 4 hours of work now takes them only 1 hour with CaseCTRL. And customized messages guide patients through their surgical journey. And since you can't fix what you can't see, HIPAA-compliant dashboards track patients so no patient is left behind. The net results from our beachhead user data show up to 300K more in annual collections per surgeon, or for example, this could mean 20 to 26 million for a hospital like UMNH. And due to 250 surgeon hours reclaimed and less admin burden, this can allow staff to really focus on better patient care. We're a SaaS annual subscription for surgeons with 3 tiers of service, and boosting surgical volume by just 1 case pays for our yearly license. We're also a generator G-Beta company, and since exiting beta in January, we're targeting individual orthopedic surgeons in private practice who can then advocate for full practice implementations. For example, one surgeon is a director of 20 surgeons who will onboard. And later on, we'll provide business intelligence data offerings as well. Financially, we're bootstrapped to date and are currently raising to reach 230 surgeons, 1 million ARR, and expand to urology. And we have the strong team in place with over 4 decades of experience in healthcare and tech. My background is in systems engineering, operational efficiency, and healthcare IT management. Dr. Dewan is both an engineer and practicing orthopedic surgeon, and our CTO, Sachi Roy, is a computer scientist with experience scaling software. And we just recruited our first advisory board member, Dr. Jay Kudna, executive director at MedStar Ortho Institute. And finally, we're looking for partners to help CaseCTRL drive the delivery of personalized surgical care for safer surgeries and happier patients. Thank you.
Thank you, judges. We have 1:30.
How does this integrate with all the different electronic medical records?
Hi, yes. So we integrate in 2 ways. So first, most of the all the results that we have so far are actually standalone, so that's where the value comes in. And integrating, we use a third party called Redox, or we can also work with LK, whichever the hospital or organization prefers. And we can also go into, for example, like Athena, they have a app orchard that we can become a part of, and we've initiated that process already. So it would open up within the EMR itself.
45 seconds. Any other questions?
Along those lines,
Pardon me?
along those lines with the electronic medical records, because I've seen a number of folks in this space. Can you help me understand kind of what's the key challenge that you're facing right now?
Sure, with electronic health records?
Yes.
Yeah, so currently the challenge would be, electronic health records for hospitals, they've invested a lot of money in it. And so integrating, it really depends on if the electronic health record plays nice with us or not. So it's really up to the hospital if they want to integrate or not. Otherwise, the electronic health record and us, we are not direct competitors, so we don't have too much trouble with them. The process we're addressing right now, it's actually paper-based processes. So it doesn't even cover the scope of what the usual EMRs cover.